In this module, you'll learn about sexually transmitted infections, or STIs, and their impact on women of childbearing age, pregnancy, and newborns. STIs can be transmitted by the exchange of bodily fluids, for example, blood and semen. They present a greater risk for women. It's important that you are familiar with the causes, treatment, and screening for STIs because they are common. In fact, a recent report showed that 25% of all teens will have had an STI prior to graduation, and that more than half of all reported STIs occur in individuals 25 years old and under. Some of the risks for women who contract sexually transmitted infections include, but not limited to, cervical cancer, chronic pelvic pain, for pregnancy, preterm birth, premature rupture of membranes, ectopic pregnancy, that's a pregnancy that develops inside the fallopian tubes, death, and psychological issues. Sexually transmitted infections were previously known as sexually transmitted diseases, and the term changed from disease to infections because disease comes with symptoms. And what you'll find is that with some of these sexually transmitted infections, women in particular are asymptomatic, meaning that they have no immediate symptoms until the infection has progressed. So throughout this module, I have inserted links to various types of videos that give detailed descriptions of how each infection is transmitted, screening, and treatment. So pay particular interest to the causative agents, treatment options, and screening processes for each of the STIs. Here I've listed some common STIs divided by their causative agents, or the category of their causative agents. Some STIs are caused by bacteria, some by viruses, trichomonas, by protozoa, and then there are some caused by parasites. We're going to focus on the ones that are highlighted in red. When thinking about STIs, have to think about who's at risk. Those who are having unprotected intercourse, individuals with multiple sexual partners, any individual who has been sexually assaulted or raped, drug-related engagement with needles or other things that come with high-risk behaviors that come with drug use, like the multiple sexual partners or unprotected intercourse. And so as a provider, as nurses, we should always be aware that you can't always tell by looking. And when we're teaching our clients about safe sex practices, especially younger populations, you want to make sure that you encourage them to question their partners about their sexual history or infection history. Examine the area for lesions or sores or rashes, discharge, etc., prior to engaging into sexual activity. When screening, we should always conduct a brief sexual history, asking the 5 P's, asking about partners, the number of partners, male or female partners, practices. What are you doing to protect yourself against sexually transmitted infections? Are you doing anything to prevent pregnancy? Have you had any previous pregnancies, any previous infections in the past? And then again, protection. When you engage in sexual intercourse, are you protecting yourself? So partners, practices, prevention, previous, and protection. Outside of abstinence, the use of a barrier method, i.e. male or female condoms, is the best way to prevent or reduce your risk of contracting sexually transmitted infections through vaginal or rectal intercourse. And so in this slide, this is an example or demonstration of instructions of how to use a male condom. And as nurses and providers, we can't assume that our clients are aware of the proper way to put on a condom, how long a condom should stay on, how to remove a condom. And so we should have that discussion with our clients and even have them either demonstrate on a model or verbally explain how to do such. When considering the various treatment options of sexually transmitted infections, there are some things that we have to consider. Cost, convenience. Is an oral or an IM injection more convenient for the client? Efficacy, which is going to give us the best outcome? And then the client. What does the client prefer as far as treatment options? Below is a link to the CDC's website on the treatment of various STIs. I would encourage you to become familiar with the standard treatments for the STIs that I had highlighted on the previous slides, those that are bacteria caused and virus caused. So pay attention to those in particular. And again, those treatments will be reinforced in the following videos. Here are a couple of videos discussing gonorrhea and chlamydia. Please pay note to the causative agent, signs and symptoms in the female, impact on a newborn and in pregnancy, treatment, diagnosis, and prevention options. In these two videos, you'll learn what syphilis is, how to diagnose syphilis, and the treatment for syphilis. Pay close attention, again, to the causative agent of syphilis, the various stages of syphilis, and the symptoms that are distinctive for each stage, the diagnosis or the diagnostic tests that are available, noting the difference between non-treponomial and treponomial test, and then the treatment for syphilis. Herpes or herpes simplex virus is a highly contagious viral infection that can be transmitted through sexual intercourse, contact with rubbing skin on skin, and one has an open lesion, and can also be transmitted to a newborn during birth. It's important to note that a cesarean section is not an automatic indication if a woman has a history of herpes. C-sections are indicated only if there are active lesions present in the genital area during labor to prevent neonatal infection. Please view the video for further details about herpes simplex virus, distinguishing between herpes simplex virus 1 and virus 2, discussing causes, symptoms, the impact on a newborn, and treatment. Viral hepatitis B, or HBV, is one of 5 various types of hepatitis. HBV is the virus that's most threatening to the fetus and the neonate. It's found in blood, saliva, sweat, tears, vaginal secretions, and even semen. Perinatal transmission, meaning transmission from mother to newborn, happens during the birth process, and this is called a vertical transmission. Screening during pregnancy happens with a test or a screening called hepatitis B surface antigen, HBsAg. If the screen is positive, follow-up tests are done to identify if there is an active or chronic disease or disease immunity based on testing for antigens and antibodies. If a woman is known to have active HBV, hepatitis B, there's no specific treatment. Rather, you encourage her to rest, good nutrition, and support. After pregnancy, she's going to have follow-up liver enzyme testing done. If the mom is infected at the time of birth, the newborn should receive a hepatitis B immunoglobulin within the first 12 hours of life to reduce the risk of that vertical transmission. Then the baby should be started on a hepatitis B vaccine regimen, with the first injection given prior to discharge. And we'll discuss more about the hepatitis B vaccine when we get to the newborn module. A mom who's just delivered may breastfeed her baby if the management that I just described, the receiving of the hepatitis B immunoglobulin within the first 12 hours and starting of the hepatitis B vaccination has occurred. So breastfeeding can take place if that management has occurred. Human immunodeficiency virus, or HIV, and its impact on pregnancy. About 27% of new infections in the U.S. occur in women. Of those new cases, 64% of them are African American women. So it's important that in every encounter, health encounter that we have with women, regardless of their reproductive age, that we should discuss and encourage HIV screening. The CDC recommends that all pregnant women be offered HIV testing at their first prenatal visit. We should repeat that testing in the third trimester for women who are high risk, so those who have multiple partners, women with current or history of drug um, abuse that put them at high risk. There are rapid HIV testing that can be done in labor for women with unknown HIV status. And the goal of this early identification is to diagnose infected pregnant women so that medication can be initiated to reduce the transmission of HIV to the developing fetus and the newborn. So, treatment with antivirals reduces the maternal to fetal transmission from 26% to as low as 1%. So, treatment is vital. Identification is vital. So, HIV infected pregnant women should be treated with a combination of antiviral drugs that are administered orally throughout the pregnancy. Throughout that treatment, she should be tested for her hematocrit, white blood cell, and platelet counts. During the labor period or the intrapartum period, she should be continued treatment. Breastfeeding in the US is contraindicated, meaning not recommended for HIV infected women, regardless if she's been treated during the pregnancy. Because many of the diseases or infections that we have discussed have great public health implications, a lot of them are considered reportable diseases, meaning that it is the responsibility of the health provider to report to the local or state or even the CDC um, agencies when a suspected or known case has occurred. So on this slide, you can see I've broken them down into a couple of categories, and this is from the Wisconsin .gov site as to which category certain infections and diseases belong to. And they're broken down into categories based on the timing of when things should be reported and who the report should go to. So, category one is not listed because that's an immediate report. Things like anthrax, botulism, things like that that have a huge, major, immediate impact on a large population. So, category two that's listed here, chlamydia, gonorrhea, hepatitis B, syphilis, need to be reported to the local health officer or department within 72 hours. Category three is just for HIV, AIDS cases, and again should be reported within 72 hours. However, the report goes to a separate HIV AIDS specific agency. So the difference in these two categories is not the timing because they're both 72 hours or within 72 hours, but it's more of who the report should go to. And again, it's the responsibility of the healthcare provider, not the patient, to report these cases of suspected or known um, infections or diseases. And now we'll talk about a couple of vaginal infections that cause vaginitis, an inflammation and infection of the vagina that are not considered sexually transmitted infection. However, there is a disruption of the normal vaginal flora, Like there's an imbalance in the pH in the vagina. So we'll talk about bacterial vaginosis, or BV, which is caused by Gardnerella vaginalis. It's the most common vaginitis. A woman's chief complaint would be a fishy odor from the vagina, and upon examination, you'd find profuse vaginal discharge that's thin, gray, or white with a milky type of texture. Treatment for BV is metronidazole or Flagyl. And it's important to treat BV, especially in pregnant women, because BV has been associated with increased risk for preterm labor and delivery. So if we have a pregnant woman who comes in with those types of complaints, we should test and treat her for BV. And BV can be diagnosed by taking a wet mount and looking for this causative organism. The second most common vaginitis is candidiasis, or yeast infection. And the chief complaint would be vaginal pruritus, meaning vaginal itchiness. Upon an exam, there will be thick, white, cottage cheese in texture like discharge coming from the vagina. Treatment can be over the counter, monostat, or prescription oral diflucan, 150 milligrams, one tablet by mouth, or the monostat is intravaginal, meaning that you would insert cream or vaginal suppository to treat the infection. Women who have recurrent yeast infections should be screened for any type of immunocompromised diseases such as HIV, things like that, that would cause this reoccurrence. So to summarize this module on sexually transmitted infections, it's important for us as nurses to have knowledge of the signs, symptoms, physical findings that are common with sexually transmitted infections in order to provide comprehensive, holistic reproductive care. It is very common that we as nurses are going to be involved in the treatment, the education, and prevention of sexually transmitted infections when we deal with childbearing families. Lastly, we talked a lot about the physical signs and symptoms of these infections and diseases, but we have to remember its psychological impact on families, on women, on individuals when they are diagnosed with such infections and what that means. And keeping in mind that there are some infections, particularly the viral infections, that there are no cure for, but treatment to subside or reduce the symptoms and reoccurrence. And then also keeping in mind that the growing resistance to treatment of gonorrhea. As with all modules, if there are questions or concerns, please don't hesitate to contact me.